you've been sedated for your surgery, it's really important that you have an escort to take you home and look after you the day of the surgery. And what we also want you to do is avoid any sorts of activities that could put you in harm's way. Operating motor vehicle, machinery, things that just would require you to not be under the influence of any of the medications that you've had in your sedation or your anesthesia. Secondly, avoid disturbing the surgical area for the first 2 to 3 days following surgery. That includes avoiding brushing, chewing of hard things, anything that could potentially cause trauma to the surgical area or the wound. You just need to be really careful. We don't want anything pulling on sutures, things that could cause trauma or pain for you. The most important approach to your postoperative care is focused on preventing swelling. Swelling is a result of inflammation. Inflammation is going to occur naturally following any sort of trauma. In other words, the surgery is going to cause inflammation. So there's 3 primary things that we'd like you to do to try to prevent that inflammation or help reduce the amount of inflammation and therefore reduce the amount of swelling. Number 1 is ice. It's important that you use ice, hold it on the side of your face where you had surgery 15 to 20 minutes per hour, and that will help slow down the circulation and prevent swelling. The easiest way to do that is with, for example, ice in a Ziploc with a dish towel wrapped around it, or a bag of frozen peas still with a light towel wrapped around it, and hold that to your face. That's very important. Secondly, you'll be prescribed medication to help reduce your inflammation. An example is ibuprofen, which is an anti-inflammatory medication that also helps reduce moderate pain. That medication will help reduce inflammation and swelling. Thirdly, elevation of your head. If we focus on keeping your head above your heart during the first 24 hours after surgery, you're going to have less swelling, and that will help you get better quicker. It's important in your postoperative period to stay well hydrated, in other words, taking plenty of fluids. You may not feel like eating, but we want to be sure that you're taking in plenty of fluids. Some minor bleeding can occur after surgery. It's not unusual to experience a slow or a minor oozing of blood from the surgical area on the day of the surgery, sometimes even the next day. The important thing is to identify the source of bleeding and apply pressure with a gauze. If you have problems and that seems to persist, I would want you to phone me, and we'll either see if we can manage that over the phone, and if not, I would want to or need to see you in the office.